I'd like to bring up the topic of networking. In the last few weeks, I've started to have local therapists reach out wanting to meet up for a meal or coffee to network. I'm hoping to get a sense of how these meetings typically go for others. Are they structured in any specific way? Do you have a little pitch you give? Do you just chat and try to build rapport? Any tips for using these meetings to maximize referrals? To me, there's two important goals to achieve in these meetings: to build rapport and to make sure the other person knows your niche and who you see. And obviously to make sure they know how to send patients to you. So I guess three things. I would definitely start off by just building rapport, because people send patients to people that they like and trust, that they feel like will provide their patients a good experience, right? They feel like they're good clinicians. So I almost think of it similarly to the initial intake phone call you do with a patient, where you're listening, but you're also dropping competency triggers. You're just dropping things into the conversation to make it clear you're well trained, you know what you're talking about, and maybe even the modalities that you use. If we know people in common, I'm probably dropping those names. Oh, and I trained at UCLA. Do you know anyone at UCLA? I might say things like that. And then I'll ask them, oh, what do you specialize in? What kind of patients should I send to you? That's obviously useful for me when I want to send them patients. Then that also lends into an easy way for me to ask them that same question. Oh yeah, for me, I kind of focus on ABC. So definitely if you have any patients with ABC, for sure, send them to me. I feel like the productive parts of the meeting takes 2-3 minutes, and the rest is just building rapport and making sure that you have a good rapport and relationship so they like and trust you, and vice versa. And the other thing I would say when it comes to networking, therapists reaching out to you, usually you probably have more to offer them than they have to offer you. So usually therapists reaching out to you, they're early in their practice. They're doing it the reason we all network. We want to build a patient panel. Therapists usually have smaller patient panels. I would still do it unless you're incredibly busy, because another question you could ask them is hey, who else do you think I should connect with? And they might be able to mention colleagues that they have who have more full practices, especially as it relates to your niche, that you could then network with. So that's another reason to network, is not just because that person may send you patients, but they may give you someone's name who ends up sending you patients. So I might also say, oh yeah, my specialty is ABC. Just out of curiosity, do you have anyone else or work with other therapists who work with ABC that might be good for me to connect with? And then, reach out to those providers as well.